symptoms and what are the stages and what you can do about hepatitis if you have been diagnosed with hepatitis. So, actually, hepatitis is an inflammation of the liver. And is there an echo or what? I'm hearing myself twice. Anyway, um, so hepatitis is an inflammation of the liver and is caused by a variety of variety of factors, and it's, it could be as a result of infections and it could be as a result of non-infection. So we have two causes or two. The inflammation of the liver can be caused by infections or non-infectious agents. So let me talk about the non-infectious agents. Non-infectious agents are things like alcohol. Did you know that alcohol can cause hepatitis? It could be as a result of autoimmune disorder. It could also be as a result of drugs. When I mean drugs, I'm talking drugs like cocaine, shisha, all these things that people take can be a cause of hepatitis because that can trigger inflammation. It can be side effect of some medications that people take. It can also be as a result of some of all this therapy that people take that they would people take this therapy that they'll go and do blood this thing to build this build part of beauty regimen. So people do these things and these things can be a cause of inflammation in their liver. So some of these beauty, this bleaching thing that people took, these vitamins that people take, sometimes this can cause hepatitis. And then we have autoimmune disorders and in case of allergies. There are some times when, because of allergic reaction or allergic hyperactivity, the person who is allergic, the liver cells gets destroyed. So these are some of the non-infectious causes of hepatitis. And then you look at the infectious cause of hepatitis. Infectious cause of hepatitis is simply the hepatitis that is caused by viruses. And these viruses, so this is caused by this is also known as the viral hepatitis. So there is a non-viral hepatitis which is caused by non-infectious agents, and then there is the viral hepatitis which is caused by viruses. So in looking at the viral hepatitis, there are 5 types. There is there is hepatitis A, there's hepatitis B, hepatitis C, hepatitis D, hepatitis E. Now, this hepatitis A is caused by hepatitis A virus and is usually an acute and short-term disease. And this infection is usually contracted from contaminated water and contaminated food. So quite a number of people do not know that hepatitis can be contracted from water and from food. They just assume that, oh, it is just from viruses. Some people did not even know that alcohol can make them to have hepatitis. Others do not even know that allergies can cause inflammation of. So hepatitis in itself is an inflammation of the liver. So anything that causes the liver cells to be inflamed, so that condition is generally termed as hepatitis. So that inflammation of the liver. So in case where it is as a result of infection, then we're looking at A, B, C, D, E. So now hepatitis B, this is caused by hepatitis B viruses, which can be contracted from blood, which can be contracted from the semen, can be also be contracted from vaginal discharge. So body fluid, hepatitis B can be contracted, and hepatitis B is one of the most common types of hepatitis that people have. And this particular hepatitis that people have, that is this hepatitis B I'm talking about, study shows that according to WHO, I was looking at the study today and it was showing to us that it's over 350 million people all over the world are infected with hepatitis B. And hepatitis B is one of the most common type of hepatitis. Hepatitis B and hepatitis C are the most common. Now, hepatitis C is also a common type of hepatitis that is also blood-borne, also from saliva, from semen, from vaginal discharge. So body secretions, the person can pick up hepatitis C. And hepatitis A is a short-term. I needed to bring that. That is it's usually short-term disease. Doesn't run for so long. Hepatitis B tends to be chronic because the person is not aware until it has really gone very far. Hepatitis C also is a chronic form of infection, and that affects about 2.4 million Americans are infected with hepatitis C. And then we have the hepatitis D. Now, the hepatitis D is caused by hepatitis D virus. This particular virus is not very common. This virus can only, someone can only contract it. It can also be contracted from blood, from semen, um, from vaginal secretions, But for someone to have hepatitis D, the person must already have hepatitis B. So D is like a complication from hepatitis B. And then we have the hepatitis E. Hepatitis E is also waterborne, and this comes as a result of exposure to hepatitis E virus, and this infection is found from water that is infected with fecal matter. We're entering the dry season now. There's tendency for people to have tests, increased tests. Now, this test can cause someone to have hepatitis. I welcome you from online today. My name is Dr. Rita Jabin. Thank you so much. I can see quite a number of people online. Thank you for joining, and also on YouTube also. Thank you for joining. The topic for today is hepatitis. I'm talking about hepatitis. Hepatitis, and I've really gone fast. So if you missed the early part of it, just go on with us. And if you have a question, you can drop it in the comment section. I will take it. But generally, I'm teaching you on hepatitis. And I finished talking about the different types of viral hepatitis. And I said to you, and I was talking about hepatitis E. And I said that this hepatitis E virus is mostly found in water, contaminated food. So the hepatitis that can be contracted from food and water is hepatitis A and hepatitis E. So it means that you can't just drink any water. You can't just eat any food that you find. And I will say to you that if you have to, take food that maybe from a restaurant or from somewhere, ensure that this thing is heated up quite very hot. So people who do not take hot food, they are more at risk for contracting this viral infection. So it's very important that you play safe, because I'm going to go further and show you what the symptoms of hepatitis are, whether it is viral hepatitis, whether it is non-infectious hepatitis. Either of them, I'm going to talk to you about what the symptoms are. But but you'll be amazed that the number of people who get infected with hepatitis E and hepatitis A every year is over 150 million people. Now, this goes to show you that the water that you take, the food that you take, greatly puts you at great risk, of these viral infections. Now, what are the symptoms of hepatitis? Whether for viral hepatitis, whether for non-viral, non-infectious hepatitis, the symptoms are the same. Sometimes there may not be symptoms at the initial stage, and then after a while it progresses forward. So what are the common symptoms? You have symptoms like fatigue, there's flu-like symptom, there's tiredness, there's change in the color of urine. The urine becomes dark and pale, and dark urine. The color of the stool changes. The color of the stool changes. There could be diarrhea. Usually, in cases of hepatitis, you find that the person has diarrhea. There could be nausea. Then, classically, there is unexplained weight loss. You just find out that the person is losing weight, or you are losing weight. You can't really put your hands around why are you losing weight. It's time for you to check yourself for hepatitis. Now, what are the stages of hepatitis? There's usually the normal healthy stage. I wish I can show you the graphical, if the graphical image can be projected to be fine, but if not, fine. So there's the healthy stage of the liver, there's the healthy liver, then there's the acute stage, which is when the infection has just been contracted, and then from there, it moves to a chronic stage. Most disease starts from the point of entry, and then after nothing has been done, it moves to a chronic stage. Then from there, it moves to cirrhosis. From cirrhosis, it now moves to the end stage. So if care is not taken in checking yourself, checking your liver, checking what you are eating, checking what you are drinking, checking some of all these new supplements and some of these things you are taking, you may be subjecting yourself to risk in the bid to want to be healthy, you may find yourself subjecting yourself to more risk than you ordinarily would have wanted, or you would have even thought that you'll be able to do. So, what are the immediate actions that someone needs to take if they are suspecting that they have some form of hepatitis, or if they have even been told that they have hepatitis? One of the important action that you need to take, first of all, you need to do a consultation. So I have, most times people come and meet me and say, I have hepatitis, do you have treatment? Do you have a common question that I get that made me to decide to do this video today? In the last 2 weeks, a lot of the people have just been dropping inquiries in my DM. Hello, doctor. Do you have treatment for hepatitis? How much is treatment for hepatitis? And I said, I can't give you treatment for hepatitis. Hepatitis is not, you don't just do treatment. We need to do a consultation. And I'm telling you the process for which hepatitis can be properly treated. And that's why I'm educating you today. You probably did not know that there is infectious and non-infectious hepatitis. So the consultation, the process of consultation is where we are going to separate. We'll take your history. The history includes your medical history, your the history of your lifestyle, the history of the environment where you have been, travel history, because sometimes you travel to a location and because of your change to travel to that location, you may have picked up a virus. So the approach of treatment for hepatitis A and E is different from approach for hepatitis B and C. Of course, hepatitis D, you have to treat the B before you get to D. You see, so first of all, there's need for consultation session to be able to know what kind of hepatitis are you dealing with, because hepatitis in itself is inflammation of the liver. That's just simply what it is. Now, so when we have done that consultation session, usually it could be 30 minutes or it could be 1 hour, depending on what the person can afford. After that, you will now be sent to do some tests. Now, you can say, oh, I've done tests. The test said I have hepatitis. That is just that hepatitis test that read positive. Usually, when I am going to initiate treatment for the people that have treated for either hepatitis B or hepatitis C, they would do their load. There's a viral load that is done. That viral load is going to help you to know what are the levels that you are at right now. What is the level of the virus in your body, in your blood? You see, so there are tests so beyond testing positive, when you finish doing a consultation, then we'll send you to do some tests. You will do some blood tests. You will do tests to check your liver enzymes. You will do tests to check inflammation. You will do tests to check your lipid profile. Remember that for non-inflammatory, for non-infectious hepatitis, high levels of cholesterol is one of the causes of hepatitis. Did you know that? And we have people who have been having high cholesterol for, say, like, they'll tell you, my cholesterol has always been high for like 5 years, 6 years, it's always high, it's not going. They just assume that, oh, it's just high. They are not looking at the long-term effect that it's having on their liver. You see? So you are going to do your lipid profile test. These tests are tests that help us to know, okay, fine, what and where is this inflammation coming from? And then you will be asked to do a scan. Usually when I send people to do scan, what am I looking at from the scan? I want the scan to check, is there fluid in your abdomen? What is the level of inflammation? If there is inflammation, what is the level? What is the size of the liver? How large is it? Because then what is happening within the cells of the liver itself? You see, the scan is going to help us to know all this. Also, it's going to tell us, is there a tumor in the liver? Is there a problem with the gallbladder? You see, this simple abdominal scan that I'm telling you about, these are the things that I want to see when the result is being, when you do this test, when you bring the result, these are the things I want to check. These are the things that will help us to know that, okay, this presence of this helps us to know. And then usually if there's a problem, it will let us know what stage, it will let us know what part of the liver is. And then sometimes also, when somebody does an abdominal scan, an ultrasound may not be enough. They may be asked to do an MRI. They may be asked to do a CT scan or an MRI to get further details. Also, this scan helps us to find out what stage of the liver are we and what would be needed to be done. You see, these things that I'm saying to you, they are very important. You cannot just assume that, oh, anything just goes. And I always say, like I always say to you, that look, when it comes to caring for your liver, you cannot just be taking anything. Just anything doesn't go. No, just anything doesn't go. It is important that you are playing with knowledge and you are playing safely. So I'm going to be taking some questions now. I'm going to be looking at YouTube to check for questions on YouTube. And I'm also going to be checking for questions on Instagram. Thank you so much for joining. The topic today has been hepatitis, and we are dealing with hepatitis. And if you have a question, if you have something that you would need me to talk about, if you have a question, please um, let me see your questions. I'm trying to look at the chat box. No, I'm not finding the chat box. I think I should go to the app directly. So, okay. Thank you. All right. So, yes. Okay. So, hepatitis. So, all right. Still waiting for your questions. If you have a question about hepatitis, you want me to talk, you have a question. I'm practically done with my teaching actually. I don't talk finish. I'm finished the education that I want to provide today on hepatitis. So remember, it's question and answer. So let me know what your questions are on YouTube. Checking out for YouTube, looking out for questions. Please check on Facebook and let me know. Okay, thank you, Sid Musa. Thank you so much. This is quite, this is indeed quite educating. Thank you so much for your feedback. I truly appreciate it. So, are there questions you want me to talk about? Thank you for the waves and everything. I truly appreciate it. So, I'm taking questions now. Otherwise, we're going to be calling it an evening. So if you have a question on hepatitis, something that I've talked about, um, please, you can drop your question now and I'm going to take it. But I think I'm done with my teaching. Today's teaching is quite brief because it's straightforward, hepatitis. So, waiting for questions, no question. Okay. Mr. Fidelis, what is the likely cause of the test mentioned so far? Okay, so I really don't know what I cannot say. I don't know what depends on where your city, which city you are in, depends on where you are located, and depends on where you go to. But I would always say that go to a standard lab. This is towards the end of the year that we are in now. If you go to a lab that they don't have so much people, you can find that they will be using expired reagents for you. And very many of all these tests are single use. They have single reagents, single use. So once they open it, they have to run it for all the people. So if it's not a lab that has a lot of patronage, you may find that your test result may be compromised. I've had people come, okay, do one need to visit your office and do the test? So for consultation, for the hepatitis, in fact, incidentally, if you remember the statistics I read to you, is very high in the US, and recently a lot of people have been reaching me about hepatitis, and I've treated quite a lot of people with hepatitis. In fact, watch out for the reviews that I'm going to post next week. Some of the patients that I've treated early in this year, even last year, quite a number of them, they've done their treatment, they've gone back for their tests. It's not a 1 month treatment, usually a 6 month treatment, and at the end of the 6 months, they go back to repeat the test and it comes out negative. I don't even need to make noise about it. Just follow the Ask Dr. Rita show page. You will see the testimonial. It's there. They are there. So you go back and do your test. It will show you negative. It won't even be detected. The viral load, there will not be anything detected at all. That's how it is. So, and all about the people that I've treated, not one of them has come to my office physically. It's from where they are. Some of them have been abroad. like 60% of them have been abroad, then 30% in Nigeria, then 10 in outside of abroad, like Africa. I'm talking like Africa. You know, abroad, you can, original abroad is like US and all that. Then Africa is not like not a serious abroad like that. Just that's just a joke anyway. So you don't have to come to my office for that. The consultation can be done online. Like I said, it can be 30 minutes, it can be 1 hour. But it's usually the consultation that determines what set of tests you'll be recommended. So I just listed generally the tests that you would be asked to go and some of the tests, but you may not need to do everything. You may need to do some, and there are some that I did not list that you may have to do. So what determines what test has to be done is from the consultation, also from the symptoms you are presently experiencing, and then also we now look at um, what what other health complaints do you have. For instance, someone that has been diagnosed with hepatitis, that is hypertensive, that's not the same treatment approach with someone that has been diagnosed with hepatitis and it's not hypertensive and maybe it's diabetic. You know, someone may be maybe have hepatitis and have other complaints associated with it. So the existing health challenge that the person has, you know, may also be a contribute. Those are all the things that will look and put together to be able to come up with a treatment plan. So I hope I've answered your question, Mr. Fidelis. Thank you for your question. So all right. So, okay, so today I'm actually talking about hepatitis. So, if you have a question that is not about hepatitis, maybe you can send that in a DM and then it can be considered as a video. Okay, so how often should we do tests for hepatitis? Um, so because so it depends on. So I'm going to answer this question in two ways. Hepatitis is not a test that you go and be checking every six months, but also is a test that you need to do like every six months. Why? It depends on what sphere of life are you working in. For instance, if you're working in a place where you are exposed to meeting people often, and where in the course of meeting people you have to touch them, you have to, you know, all this, it may be good for you to first of all go and run a test and find out that you're negative, carry yourself and go and take hepatitis vaccine. By the time I'm going to be reviewing the different viruses individually and how to prevent them, I'm going to talk to you about the hepatitis vaccine, you know, but I could just mention it here. So it depends on what where do you work. If you I remember when I just got admitted into school and I had to do my studies, that was one of the things that one of my professors, she insisted that, look, you have to go do hepatitis. So we did the test and I had the first, second, I've had all the vaccines, even to the booster, the 10 years booster, I've had it. You know, I needed to do it because I'm meeting people and quite a number of hepatitis people have come to meet me for therapy and for consultation. And some of them I've had to meet them. Some of them I didn't know they had hepatitis until they told me what the problem was, and I had already shaken them. You know, so of course it depends on. So it's not a test you have to do often if you are not physically meeting with people. If you don't have, remember that we are even looking at this one I'm talking about the viral hepatitis. What about the non-viral hepatitis? You see, how are you going to check for about what are you doing about that? The one that comes from high levels of alcohol intake, the one that comes from high levels of cholesterol, the one that comes from drug abuse, the one that comes from drug misuse, the one that comes from allergic reaction. You know, some weeks ago I did a live on allergy. And I was telling you the impact of how an allergic reaction can destroy the kidneys. And I'm also telling you today that allergies, autoimmune disorders, where your immune system produces antibodies to destroy your liver cell, that can be a cause of hepatitis. So the cause determines the actions that needs to be taken. So while it is good that you want to check for hepatitis frequently, It's also good that you have a session with your doctor. Have a session. This session helps to avoid you spending too much money going to be running tests. So I hope, Omas here, I hope I've been able to answer your question very well. Um, so I have like less than 5 minutes to the end of this live session. I hope I've answered all your questions on hepatitis. So I'm just going to do a brief, quick recap on what I've talked about for the sake of those that have just joined us and are joined us online. So today's session was on hepatitis, and I told you that what hepatitis is. Hepatitis is inflammation of the liver. Now, there are two types of, or two categories of hepatitis or inflammation. There's inflammation that is caused by infectious organisms like viruses, and then there are the ones that are caused by non-infectious organisms. They are known as non-infectious hepatitis. So those non-infections, what are the things that are non-infection? Hypersensitive immune system. I told you about a test to do to check your immune system, whether it is becoming hypersensitive. Don't joke with these things, you see. Hypersensitivity, alcohol, and I told you last week, I told you, I was saying to you that if you take above 140 grams of alcohol in a week, you are already putting yourself at a risk. If you didn't watch the video last week, please watch it. See, so alcohol, excessive alcohol consumption, drugs, side effects of some drugs, and then drug misuse and drug abuse can lead to that. And then environmental toxins, where you work, exposure to poisonous chemicals, this can cause hepatitis. And then, so just to mention some of the things I've mentioned before. And then you have the infectious hepatitis, which is viral hepatitis. This is caused by viruses. There are 5 of them. There's hepatitis A. This is caused by hepatitis A virus. There's hepatitis B. That is caused by hepatitis B virus. Hepatitis C caused by hepatitis C virus. Hepatitis D caused by hepatitis D virus. E caused by hepatitis E virus. And A and E are usually contracted. That virus can be found in dirty environment, can be found in dirty water. Mode of contracting that infection is from water, from food, particularly water that is exposed to fecal matter. So it matters a whole lot where you take your water. Then hepatitis B, hepatitis C, hepatitis D. These 3 can be contracted from blood, from vaginal discharge, normal vaginal discharge, from semen, and from saliva in some cases, you see. So these are means by which people contract. And I told you what the symptoms are, and I've told you what to do to care for yourself. Yeah, so it's not just okay, Chika. Last question I'm taking. Chika, is it contracted only through blood or not only through blood? I've mentioned the body fluid like your semen, like your vagina, yeah. So body fluid, even your sweat too has been shown, documented. But of course, it has to be. It's not just small sweat. It has to be heavy sweat, so that can cause that. And then deep kissing, and you can exchange that if the person has a cut or if the person has this thing. So yes, body fluid is one of the ways. Can a husband infect wife? I mean, if from the semen it can be transferred, if it's from vaginal fluid, what are you saying? So it's very good you know yourself. Knowing yourself is very good. Know yourself, no, because know yourself, know your status, and have knowledge, and that's part of why I am here teaching you these things this evening. I thank you so much for your logging into the time to this program. Next week, I'm going to be um, up again by 7:30 to 8 o'clock, but it's not going to be live. It's going to be pre-recorded, but I'm going to be dropping a teaching in line with this hepatitis that I've talked about. You don't want to miss it. So you can catch me 7:30 next week as I give you the topic for next week. And I'm sure you have learned something new. So if you have hepatitis, you have some concern, please call the numbers showing on the screen: 07061713985, or you can send a DM to my inbox. If you're on Instagram, just send a DM, ask Dr. Rita Show, and I'll be right there in the DM. But if you want to talk, you can easily call my number 07061713985. Please take care of yourself. Have a good evening. God bless you. Bye.